Hello everyone. Today we will be discussing biopsy. Biopsy is one of the principles of surgery and is very important in day-to-day dental practice. So, to coming to what is biopsy? So, you would have seen in your clinics or in hospital setup, whenever any patient comes with a swelling or an unknown pathology, we take the tissue from there and send to histopathology labs for clinical and histopathological examination. So, then a report comes. Based on the report, we do the further treatment. So, these biopsies are of different types which we will be discussing today. So, coming to what do you mean by biopsy? So, the word biopsy is made up of two words. First one is bio and the second word is opsis. Bio means we all know that is life and opsis means the vision. So, that means we are seeing a healthy tissue or a living tissue or an unhealthy tissue, that is called biopsy. So, the definition of biopsy goes something like this. So, biopsy is defined as the removal of the tissue from the living organisms for the purpose of histopathological examination and diagnosis. So, you incise that area under local anesthesia, take that area, send it for store it in a fixative solution, send it to laboratories where they will further examine it, and on the patient where you have done the surgery, you will close it, and then antibiotics and painkillers will be given and further maintenance of that surgical site needs to be done. So, that is the basic funda over here. So, the World Health Organization has also defined biopsy in a different way. They define biopsy is the examination of the tissue which is removed from a lesion, and by extension the term is used to convey the removal of the tissue. So, the removal of the tissue is called biopsy. That is World Health Organization definition. So, now from which all sites we can do biopsy? So, biopsy can be done from various sites. In oral and maxillofacial surgery, we can do it from the lower lip, what you can see it here, lower lip. If any lesion is there, we can do it, or from the site of gingiva we can do it, second one, or from the lower border of the tongue or the floor of the mouth, anywhere we can take biopsy, from the cheek. So, we can do from any part of the body. So, whenever the tissue is taken, it is stored in a fixative solution. So, around 20 to 30 minutes it is stored in a fixative solution, and then it is taken, the lid is closed and it is taken to the lab. So, that is what basic thing what we know. So, this is biopsy. So, why do we need biopsy, or in other words the indication of biopsy, what I am going to talk about right now. So, coming to the need for biopsy. So, any lesion which is clinically suspicious, you see a lesion very drastically or at a very fast rate, the tissues are changing, the color is changing, the texture of the skin is changing, or the growth is happening. So, clinically very suspicious. So, that is indicated for biopsy. Second one, to confirm a presumptive diagnosis made on clinical and radiological finding. You got clinical finding, the tissues are changing in color and texture, and radiology also tells that there is some bone loss happening. So, clinically and radiologically some changes are being noted. So, how to confirm it? So, the confirmation will be done by sending the tissue to the histopathology lab by doing biopsy. So, with the biopsy the confirmed report will come. Next one is when the dentist cannot reach to a definitive clinical diagnosis. So, you have a clinical diagnosis, a radiological diagnosis, but a definitive diagnosis is not there. The confirmative diagnosis is done only after the biopsy report, that is histopathology. And based on biopsy report, the treatment plan is made. Whether a surgery has to be performed or the chemo has to be performed, whether it is a malignant lesion or it is a benign condition or whether it is a cancer. So, all those things will be determined, and based on that, a further course of treatment is given. So these are some of the few needs for biopsy. And the other needs is it is a valuable in self-teaching diagnostic aid. So our clinical diagnosis we made based on our experience, based on radiology we got a report. So to check whether our diagnosis is correct or not, biopsy gives a valuable aid. And biopsy is done in cancerophobic patients, like patients who are very particular about their tissues or skin on any part of the body. They are not comfortable with that extra growth. They want to rule out whether cancer is there or not. So for them, you can do a biopsy and the reports will tell everything. And it is also very important in maintaining a medical legal record. So later on, the patient should not say that because of your treatment it started earlier. Only when biopsy is done, you will get an idea what the patient was having or what lesion he was having. So these are the need for biopsy. In this condition, we should go for biopsies. Now, next coming to that is the indications for biopsy. So there are n number of indications. First and foremost, the first indication is any lesion which is persisting for more than 2 weeks, 10 to 14 days, any lesion was there, you gave a traditional antibiotic, painkiller or some ointments, but no healing took place. The situation is still the same or it has become worse. So in that case, you should go for a biopsy. And then the lesion is not responding to local treatment for 10 to 14 days, you should go for biopsy. So any lesion staying for 14 days, you should go for biopsy. Not responding to treatment, you should go for biopsy. And any persistent hyperkeratotic changes in the soft tissues, the skin texture is changing, hyperkeratosis is happening, then also you should go for biopsy. So coming to the indications for biopsy, so any persistent tumor suspected being neoplastic. So you have a swelling, the patient has a swelling and you feel that transformation is taking place. Some metaplastic or dysplastic changes are taking place. Then definitely you should go for biopsy. And then inflammatory changes with some unknown causes. Inflammation is there, some unknown causes and it is persisting for a very long period of time. You should go for a biopsy. And any infections or lesion that interferes with the local function, we should go for biopsy. And any tissues which is surgically excised, that also you should go for biopsy. And any tissue spontaneously which is expelled out from our body, if any tissues is expelled out, that also you should examine what it is and why it happened. So these are few indications for biopsies. Coming to the further indications, and any swelling or draining abscess is there or sinus. Sinus is one-way opening. Fistula is two-way opening. So if material from a persistent draining sinus whose source can't be identified, then you should go for the biopsy if there is a draining pus or sinus is there. Any bone lesions not identified clinically and radiographic findings are not supporting bone lesion is there, then you should go for biopsy. And any lesion which has characteristics of malignancy, which we already discussed, any neoplastic changes or dysplastic, metaplastic changes, hypertrophy, hyperplasia is happening, then also the tissue you should go for biopsy. So this were the indications for biopsies, almost some 10 to 15 indications we discussed. So now coming to the contraindications, that means we should not do biopsy. First and foremost, biopsy should not be done in a patient whose general condition, who has a very poor general condition, very weak, anemic, less weight, looking very pale. So definitely wherever you do the biopsy, healing will not be fine. Or if there is a diabetes, so in incisions you are going to put, healing will be difficult over there. So the second indication will be any acute virulent pyogenic infections. If there is some bacteremia in the body, the patient is having fever or some already infection is there, then the whole generalized infection of the body, in those cases also you should not go for biopsy. Let it subsidize and then you can go for biopsy. And any patients who is having any blood related problem, that is blood dyscrasias, like hemophilia or von Willebrand factor disease, or any of the factors are deficient and healing problem is there, then there you should not go for biopsies. And any tumor or any tissue origin, anything which has got vascular origin, blood related, arteries related, so those kinds of tumors also, like hemangiomas, you should not go for biopsy immediately. You have to rule out everything, and if indicated, then only on a controlled atmosphere where you have backup, you're doing in a hospital, you have got a blood bank, you can do a surgery and save the patient, then only you should do. This comes under almost like absolute to relative contraindications. So we have discussed the introduction part, and then the need for biopsy, indications for biopsy, and the contraindications for biopsy. So now coming to the whole flow chart. What is biopsy? Like, the biopsy can be done surgically and non-surgically. Two types of biopsies. So first one is surgical, second one is non-surgical. So we will go with the first one, that is the surgical biopsy, where you are giving an incision, taking the tissues out and suturing it up. So the first one, surgical biopsy, is done in two ways. You can do it in a soft tissue, you can do in a hard tissue, that is bone also. So in a soft tissue, you can do it for diagnostic purpose or a curative purpose. If you are doing for diagnostic purpose or curative purpose, again you have got incisional biopsy, excisional biopsy, incisional, excisional biopsy. And this incisional biopsy, where you're removing a small part from the whole, like a small cake piece you're taking from the entire cake, a small, you have a big lesion like this, you're just taking a small part, that is called as incisional biopsies. So that can be done by punch biopsy, electrocautery, soft tissue curettage, and frozen section also. And if you are going to go for a curative reasons, you want to cure the problem, so you have to remove the entire mass and then you have to send it for biopsy. So the indications will be less than 2 centimeter, you can go for excisional biopsy. So you can do with a scalpel or you can do with a electrocautery also. That is soft tissue. And if you are going to do a biopsy of the bone, then again diagnostic purpose, curative purpose. For the diagnostic purpose, to know what is the problem, you have curettage, trephine, aspiration, frozen section. And for curative, enucleation, resection and curettage you have got. So these are for the surgical ones. And for the non-surgical reasons, non-surgical, you can do a biopsy by doing an aspiration. You can take a needle, a big deep seated lesion, lot of fluid content is there, you can inject the syringe there, the needle will go inside the swelling and you can aspirate. So that is called as aspiration. Your FNAC comes here. And then you have got cytology methods also. Cyto means cells. So the exfoliative cytology comes here, where the cells which are shedding off, those cells will be collected and it will be examined. So you have got exfoliative and fine needle aspiration cytology. So this flow chart tells entire concept of biopsies. So now what are the different types of biopsies? So the different types of biopsies, there are some 7 to 8 types. The first one is excisional biopsy. Excision. So excision means you are removing the whole mass. If there is a small swelling like this, you give an incision in and around and you are taking everything out. The whole mass you are taking out, that is called as excisional biopsy. Second one is incisional biopsy. So like a big swelling is there, you are taking only a small piece. A small portion you are taking it and the remaining part you are suturing it. That is called as incisional biopsy. And then third one is like called a punch biopsy. Like when you give a punch, you go, see, it's a fist. So it's almost like a circular one. You go and give a hit. So in the punch biopsy, you will have an instrument something like this, cylindrical, which will go and take the tissues out from that. That is called punch biopsy. The fourth one is your frozen section biopsy. Then you have got exfoliative cytology, FNAC and brush biopsy. These are the 7 types of different types of biopsy. Whatever types, the indications, contraindications and the need of the biopsy remains the same. So now whichever type of biopsy we are doing, we have to follow some protocols. So the protocols are like this. First and foremost, when the patient is indicated for biopsy, all the reasons he has justified, yes, we should go for biopsy. So you will give an anesthesia. So step number 1 is anesthesia. Step number 1, anesthesia. So local infiltration you can give, or you can give a block also. Then after that, you have to give incision. So the incision has to be precise, and short continuous is not preferred. You can give a long incision. So this principles of surgeries needs to be followed here. And after the incision is done, then there will be massive bleeding. Definitely, it is anticipated. So the bleeding has to be arrested by measuring or adopting hemostasis measures. So first one is anesthesia, incision and then hemostasis. So once the bleeding is controlled, you remove the mass, the tissue mass, and then you suture it. So that is called as surgical closure. And then in the end, handling of the tissues is very important. So please do not forget, these are the 5 steps. You have to go step by step. First is anesthesia, incision, controlling of bleeding, that is hemostasis, suturing, that is surgical closure, and handling of tissue. So these 5 steps you need to follow one by one. So now we will go into the first type of biopsy, that is called as your excisional biopsy. Excision. So excision means you are taking everything out. So as you can see in the slide, you have a tumor mass over here, a small tumor mass. So in and around you are going to give an excision and you are going to take it out. So now there should be some protocols. Which tissues are indicated for excision and who are not indicated for excision. So we will go into those aspects. So an excisional biopsy implies to the complete removal of the lesion for microscopic studies. Whole lesion, everything in toto you have taken it out. No remnants, no daughter cells are kept there. Everything is taken out. So the technique for excisional biopsy, the entire lesion is taken out, complete removal with 2 to 3 millimeter of normal appearing tissues also. This is the golden mantra what you have to follow. Whenever you are removing the diseased mass, along with that 2 to 3 millimeter of healthy tissue also you should take it out. So that will give a reference for the pathologist to know what is healthy and what is unhealthy. Normal and abnormal tissues, they will have differentiation to study. So always in your biopsy, healthy tissue also should be there. So 2 to 3 millimeter of normal appearing tissue surrounding the lesion also should be taken out. So now the advantages of excisional biopsy, it can be used for both diagnostic and therapeutic reasons. Therapeutic, diagnostic means you will come to know what is the lesion and you will give treatment accordingly, medicines accordingly. Therapeutic means you have done a surgery actually, you have removed the entire mass out, and so that is a therapy in itself. Then because you have removed the entire mass, a second surgery is not required. So the advantage is need not perform separate surgery for this. So that is very important. So now coming to the indications for this method, excisional. So you can excise anything which is less than 2 centimeter. This is very important. This is a viva question. So anything above 2 centimeter or tissue you want to remove, you can go for incision biopsy. And whatever is below 2 centimeter, you have to go for excisional biopsy. So should be employed for small lesions less than 2 centimeter. And then the lesion on clinical examination, they appears benign. If it looking benign, then only it's better to take out. If metaplastic or neoplastic changes you are seeing, do not take it out, because that will act, your blade, the incision will act as a stimulus, and then it can grow more faster rate. Then when complete excision with the margins of a normal tissue is possible without mutilation, the whole thing you can take it out without inserting the tissues, you can go for this. So these were the indications for excisional biopsy. So what are the contraindications? So contraindication, any lesion which is greater than 2 centimeter, bigger than 2 centimeter, don't go for excision, go for incisional biopsy. Now you can see a lesion over here, such a big lesion. So definitely it is more than 2 centimeter. So you should not go for excision. So here incisional biopsy is only the better option. Then the excisional biopsy, whenever a mass is there, what should be done? So suppose you see a lesion over here, you have a lesion over here. So around the lesion, two convex incisions should be given. So you have a lesion over here, two convex lesion which are approaching at 30 degrees, which is very important. So the angle what they form, this angle should be 30 degrees, and then the length should be 3.5 centimeter, and this much width should be 1 centimeter. So this is an ideal. So then the suturing will be very easy. So this point is extremely important what I told. So you have a lesion, so an incision is kept around the lesion, and then with your scissors you will go inside and you will do a blunt dissection on this part. You will do a blunt dissection 2 to 3 millimeter around the tissues, the pathological diseased part, you will do the dissection. So blunt undermining of mucosa with wound margins are done after removal of the lesion, and then once you suture it, operation site after suturing should resemble something like this. So same way, another example. So when you are giving an incision, you should go as deep. This much deep should be there. It should not be a superficial. It should be deep incisions, shallow and deep, not wide. So once you remove the mass outward, you get like this, and so suturing is very easy. You can suture it very faster rate. So this is what I was telling. So whenever you have a tumor mass here, so the two convex incision meeting at 30 degree angulation, the length of the lesion, you will go left side and the right side of the lesion. So total should be around 3.5 centimeter, because the lesion what is indicated for biopsy excisional is only 2 centimeter and less. So 2 centimeter will be the tumor mass and total should be 3.5. So you have got 1.5. So 0.7 or 8 mm you will go on the left side, 0.7 or 0.8 mm you will go on the right side of the lesion, and the total width should be 1 centimeter. This should be followed. Then coming to the next biopsy, that is our incisional biopsy, we will discuss in our next session. Thank you.